Multiple myeloma is a malignant bone marrow disease where abnormal plasma cells, also called myeloma cells, grow uncontrollably. It is the second most common hematological malignancy after non-Hodgkin's lymphoma. It's most commonly seen in older adults, typically over 65 years old. Multiple myeloma typically presents with bone pain, especially in the back and ribs, fractures in the ribs and vertebra, weakness, fatigue, weight loss, also called B symptoms, repeated infections due to immune suppression, kidney damage caused by excessive paraproteins, increased bleeding due to low platelets, and hyperviscosity syndrome, which is thickened blood leading to headaches and vision issues. So, how does multiple myeloma affect your blood? Paraproteins in blood are detected via protein electrophoresis. There's also an increase in erythrocyte sedimentation rate. M gradient can be seen on electrophoresis. In multiple myeloma, IgG is typically elevated. An elevated IgA shows poor prognosis. There's also low normal immunoglobulins. Protein in urine shows a Benz-Jones protein. Row-loose formation are typical findings showing red blood cells stacking like coins. The complete blood count shows leukopenia, neutropenia, and anemia. And comprehensive metabolic panel shows high creatinine and urea and also shows hypercalcemia. To confirm multiple myeloma, imaging can be used. Typically, X-rays shows lytic bone lesions, which are punched out holes in the bones. CT scan or MRI is used to evaluate bone and soft tissue involvement. PET-CT detects active disease spread. The treatment goal is to reduce growth of myeloma cells, which in turn slow disease progression and improve quality of life. The first-line therapy is chemotherapy. If the patient is eligible for stem cell transplant, high-dose chemotherapy and autologous stem cell transplant is done. If the patient is non-eligible, chemotherapy is used alone, for example, dexamethasone. After stem cell transplant, maintenance therapy is given. In multiple myeloma, it's also important to manage complications. For example, in bone disease, bisphosphonates, calcium, and vitamin D is administered. In hematological cases, red blood cells, platelet transfusions, immunoglobulin therapy, and GCSF is given. In case of infections, to prevent that, vaccinations, specifically influenza and pneumococcus, is given. In case of kidney damage, high fluid intake is administered. In case of high paraproteins, plasmapheresis is done. To manage pain, analgesics is given. For multiple myeloma, there is no complete cure, but treatment can extend life significantly. Patients receiving stem cell transplants tend to live longer. The median survival is approximately 6.7 years, though new treatments continue to improve outcomes, and therefore an early detection and treatment can improve quality of life. So to sum it up, multiple myeloma is a cancer of the plasma cells in the bone marrow. It commonly presents with bone pain, fractures, fatigue, infections, and kidney damage. Diagnosis is confirmed through blood tests and imaging, and while there is no cure, treatment options like chemotherapy, stem cell transplants, and supportive care can help patients live longer with a better quality of life. Hope this video made multiple myeloma a bit more clear. Thank you for watching. See you next time.